Nurses who work with dying patients see the same thing happen over and over again in those final minutes before death. There's a pattern, a sequence of changes that unfolds in nearly every death, regardless of what's killing the person. And while every death is unique in its meaning, the physical process of dying follows a script that experienced nurses can read like a familiar story. They know what's coming next, they know how much time is likely left, and they know what these final changes mean even when families are terrified by what they're witnessing. Let's talk about what a nurse actually sees in those final minutes, because understanding this can transform one of life's most frightening experiences into something you can face with knowledge instead of terror. The first thing a nurse notices as death approaches is the change in breathing, and this is usually the most reliable sign that the end is near. The breathing becomes irregular. There are long pauses between breaths, sometimes 10, 20, even 30 seconds where the person doesn't breathe at all. Then a breath comes, sometimes deep, sometimes shallow, then more pausing. This is called Cheney-Stokes respiration, and nurses see it constantly. When this pattern starts, nurses know death is usually hours away. Here's what nurses understand that families don't. Those terrifying pauses aren't the person suffering or struggling. The dying person isn't aware they're doing this. Their brainstem, which controls breathing, is failing and misfiring signals. To a family member, each pause feels like the final breath, and then another breath comes and hope surges. It's emotionally exhausting to witness, but nurses know this is a normal, expected part of dying that doesn't cause suffering. The second thing a nurse sees is the change in the sound of breathing, the death rattle. As the person loses the ability to swallow or clear secretions, saliva and mucus accumulate in the throat. Each breath moves air through these secretions, creating a wet, gurgling sound. It can sound like the person is drowning. Families often panic. Here's what nurses know. The death rattle sounds far worse than it is. The person isn't drowning or choking. They're typically unconscious and completely unaware of the sound. Nurses might reposition the person or give medication to reduce secretions, but this is often more for the family's comfort than the patient's, because the patient isn't suffering from it. The third thing a nurse notices is the change in skin color and temperature. The hands and feet grow cold. The skin becomes pale, then takes on a bluish or grayish tint at the fingertips, toes, and lips. Then mottling appears, a blotchy, purplish, marbled pattern, usually starting on the feet and knees. Nurses see this and know death is very close, often within hours. Here's the science nurses understand. As the heart weakens, blood flow to the extremities decreases. The body is prioritizing the vital organs by pulling blood away from the skin and limbs. The mottling is blood pooling in small vessels near the skin surface. It's not painful. It's a sign the circulatory system is shutting down. If you're learning what really happens in the final minutes of life, hit subscribe. We're revealing what experienced nurses witness at the bedside every single day. The fourth thing a nurse sees is a change in consciousness. Most dying people become less responsive as death approaches. They stop opening their eyes, stop responding to voices, stop reacting to touch. They slip into what looks like a deep sleep. But here's what's important. Nurses believe hearing is one of the last senses to go. Here's why this matters. Even when a dying person appears completely unresponsive, nurses encourage families to keep talking to them, because there's reason to believe the person can still hear. Nurses have seen dying patients shed a tear when a loved one spoke, or show a slight change in breathing when a familiar voice entered the room. They urge families to say what they need to say until the very end. The fifth thing a nurse notices is terminal lucidity, the surge. Sometimes, in the hours before death, a person who's been declining or barely responsive suddenly becomes clear, alert, and present. They recognize people, have a coherent conversation, say goodbye. Families think this means recovery. Nurses know it often means the opposite. Here's what nurses gently prepare families for. This surge of clarity is frequently a final gift before the end, rather than a sign of improvement. Nobody fully understands why a failing brain sometimes produces a moment of startling clarity, but experienced nurses have seen it enough to quietly encourage people to use this time to say what they need to say, because it may not last. The sixth thing a nurse sees is changes in the eyes. They become glassy or unfocused. They might remain partially open even when the person is unconscious. The pupils become fixed, no longer responding to light. As the brain shuts down, the reflexes controlling the eyes fail. Nurses gently close the eyes if they remain open, for the dignity of the patient and the comfort of the family. The seventh thing a nurse notices is the relaxation of the body. Muscles relax completely. The jaw drops open. There's often loss of bladder and bowel control as sphincter muscles release. Nurses handle this quietly and respectfully, protecting the dignity of the person even in death. The eighth thing a nurse sees is the moment of death itself, often quieter than families expect. After the irregular breathing and long pauses, there's finally a last breath, and then nothing. The chest goes still. Moments later, the heart stops. Sometimes there's a final movement or small gasp, an agonal breath, that can startle families. But this is a reflex, not suffering. Death, in most cases, is quiet. The ninth thing a nurse observes is the profound stillness afterward. Within moments, the person's face often relaxes further. Tension melts away. Many nurses describe the dying looking younger, more peaceful, more like themselves in those first minutes after death. There's often a palpable sense that something has changed, that the person is no longer present in the body. The 10th thing a nurse does is care for the family in those raw moments of grief. Some people sob, some go silent, some wait for another breath. Nurses have learned there's no right way to react, and they hold space for whatever families need. Presence without pressure. They don't rush the family. They explain gently that there's no hurry, that they can stay as long as they need. What really happens in the final minutes before you die is a predictable sequence that nurses witness again and again. The irregular breathing with its terrifying pauses, the wet rattle that sounds worse than it is, the cold and mottled skin, the retreat into unresponsiveness with hearing lingering to the end, the sometimes startling surge of final clarity, the changing eyes, the relaxing body, the quiet last breath, and the raw grief that follows. To families, each sign can be frightening. To nurses, they're a familiar language. Understanding what a nurse sees every time can take some of the terror out of death. The pauses in breathing aren't suffering. The rattle isn't drowning. The mottled skin isn't pain. The unresponsiveness doesn't mean your words go unheard. These are the normal, universal signs of a body completing its final task. Knowing what the nurse at the bedside already knows means that when you're facing the death of someone you love, you can meet those final minutes not with panic, but with the quiet understanding that this is how life ends for nearly everyone. And there is a strange comfort in that shared, universal human experience.